Question 1. A 54-year-old woman presents with complaints of finger discoloration on exposure to cold, difficulty swallowing, and recent development of small calcified nodules on her fingers. She also notes that her skin feels tight on her fingers and face. On exam, she has telangiectasias on her cheeks and sclerodactyly. Labs reveal a positive ANA and anticentromere antibodies. Which of the following is the most likely diagnosis? A. Limited cutaneous systemic sclerosis, CREST syndrome. B. Diffuse systemic sclerosis, C. Polymyositis. D. Systemic lupus erythematosus. E. Mixed connective tissue disease. Correct answer, A. Limited cutaneous systemic sclerosis, CREST syndrome. CREST stands for calcinosis, Raynaud phenomenon, esophageal dysmotility, sclerodactyly, and telangiectasia. It is a limited form of systemic sclerosis and is strongly associated with anticentromere antibodies. Why not the others? B. Diffuse systemic sclerosis, more likely associated with anti-SCL70 and involves the trunk and proximal limbs, not limited to distal areas. C. Polymyositis, characterized by proximal muscle weakness and elevated muscle enzymes, not calcinosis or sclerodactyly. D. SCLE, may have Raynaud and positive ANA, but not the other CREST features or anticentromere. E. Mixed connective tissue disease, associated with anti-U1 RNP antibodies, not anticentromere. Question 2. A 62-year-old woman with a long-standing history of Raynaud phenomenon and esophageal reflux is found to have skin tightening over her hands and face. She recently developed small painful calcifications on her fingertips. Lab testing is positive for anticentromere antibodies. Which of the following complications is most likely to develop in this patient? A. Pulmonary arterial hypertension. B. Interstitial lung fibrosis. C. Renal crisis with malignant hypertension. D. Myocarditis with arrhythmias. E. Diffuse proximal muscle weakness. Correct answer, A. Pulmonary arterial hypertension. Pulmonary arterial hypertension, PAH, is a classic late complication of limited cutaneous systemic sclerosis, CREST. It results from vascular remodeling, not fibrosis. Why not the others? B. Interstitial lung fibrosis, more common in diffuse scleroderma, especially with anti-SCL70. C. Renal crisis, seen in diffuse systemic sclerosis associated with anti-RNA polymerase III. D. Myocarditis with arrhythmias, can occur in diffuse disease but less characteristic of CREST. E. Diffuse proximal muscle weakness, suggests inflammatory myopathy like polymyositis, not CREST.